Hello and welcome to the healthcare chapter of the Mint CXO Dialogues. I'm your host Gautam Srinivasan, and I am joined by a host of industry leaders to talk about how innovation is the new normal. It's quite an interesting topic considering the times we live in currently. So let me quickly introduce the speakers for today. Joining us are Vivek Digumarti, who's the AVP and Head of IT at Sai Life Sciences Limited. Prakash Dhamija, Managing Director of Gary Scheimer. Sumit Pathak, Digital Workforce Evangelist, IMEA at Automation Anywhere. Rajiv Sikka, Senior Vice President and Group IT Head at Medanta. Sudeep Mazumdar, Global Chief Digital and Information Officer at Piramal Glass. Sanjeev Vashishta, MD and CEO Pathkind Diagnostics. Tanmay Saxena, COO 1MG, and Geeta Manjunath, founder, CEO, and CTO, Nirmai Health Analytics. So we've got quite an action-packed panel lined up for you to understand how innovation is the new normal. So let's dive right into the conversation. Vivek, we'll start with you. In terms of acceleration, development, and manufacture of small molecules, we're discussing an industry which is ever dynamic, where every day new problems emerge and you have to figure out solutions for your clients. So in terms of the acceleration, development, and manufacture of small molecules, how do you think automation, which is the focus here under the Sai Next initiative, helps you enable your pharma and biotech clients to bring in their products to market at a faster pace?
Right. So basically, like last year, we have engaged one of the leading consulting company, and we did a war room, and we did an analysis, and we got a goal called Sai Next, and accordingly, we derived the automation, which are all the automation that are needed in bringing the molecules or the development or the clinical trials or manufacturing APIs, and how we can quickly uh, uh, complete and how we can provide this to the customers. So from that aspect, we have identified a lot of digitization initiatives, starting from the using the RPA, which is Automation Anywhere. Similarly, the data lake project, so that we can utilize the analytics, which will bring down the lot of dashboards, which will help in real time analysis and take decisions proactively. And similarly, there are a lot of other integrations and digital transformation that has implemented, including due to COVID. We also brought in the virtual tools, using the virtual glasses, by using Realware and Microsoft Teams, through which now, even though the customers can't visit our facility, now they are able to see our facility, the reactors, live through virtuals, and even they are able to do a remote audit using these technologies. And thus we could able to bring new projects than before. In fact, the pandemic has given us an opportunity to implement a lot of digitization front, which is now helping us not only from the manufacturing perspective, but a lot of other automation initiatives.
Got it. So it's not just work from home that we're discussing, but it's also about service at home for customers. And automation is playing a big part in enabling firms like you to service your clients better, so that they can come up with opportunities for their customers as well. And we'll go around the table to understand how all of your companies have made innovation the new normal. We'll go to you, Prakash. What are the core challenges that you see that automation is yet to solve for packaging and logistics? Before we get to everyone's story, we want to understand the challenges at play. So what would you say are the core challenges?
Yeah, core challenges I would say, so first of all, just to give you a small background, we are operating into a segment of B2B. So we are into the packaging industry, and we are providing a pharmaceutical packaging. We are not like directly like in molecule or directly associated with medicines. But the biggest challenges is to understand the requirements. So we are using the technologies that what are the market requirements. So we have a philosophy in the company as well to understand the requirement of patients, even though our customers are really the pharmaceutical manufacturer, but eventually our products are being used by the customers who are the real patient. So the challenge is to understand and to make sure, because see, you need to provide the product right at the time, which is the really requirement of the market. I quote a small example here. For example, especially in India, we are working on a certain products like diabetic. So we need to we are planning to bring in some easy to administer diabetic pens, which will be controlled by application.
Hmm.
So the patient can wear it. We call it wearable injectable. So that will be controlled by directly use of the technology. So it will be controlled by an app. So any person who wants to take the medicines can just at the time of dinner table put it a alarm. Okay, 8 o'clock he needs, and just with the punch of just a yes, the insulin goes in. So we
Hmm.
there are a lot of challenges in terms of understanding. For example, the if you see the we have done the detailed analysis of the data of the patient's requirement.
Hmm.
For as Mr. Vivek was mentioning, we have also had certain consultant to understand the requirement of the customers. A live example came like, for example, in US where we are operating as a glass manufacturer also.
Hmm.
So out of the calls which 911 the ambulance is getting, 1 out of 5 is not life threatening. So how do you make sure that whether you reach, because if you are missing your 20% of the efficiency for those who don't need it, so then you lose the productivity and efficiency. So
Hmm.
the biggest challenges is to make the right available product at the right time and according to the need of the patient, not only understanding the like from the customer perspective. And latest technology we bring is from in manufacturing, like we are manufacturing the syringes. So we are
Hmm.
bringing during the production of syringes, there is a interaction of metal during manufacturing. So we have a latest patented technology where we produce metal free syringes.
Hmm.
So to understand certain molecules which are really when they get interacted with the or get exposed to the metal, so their efficacy goes down. So the target is that whatever be the latest development, new diseases coming in, and
Hmm.
thankfully, and for syringes and vials, we are the one of the leading manufacturer. So it's an
Hmm.
opportunity for us, but at the same time, it's a moral responsibility to us. For example, especially in India, we were like very badly struck by the supply chain. No
Hmm.
trucks were allowed for the movement. So now we have to interact with the local authorities to get the permission to run the production, to get the truck moving.
Hmm.
So these are all the challenges you have to overcome to make it your product available where it is required to the patient.
All right. Sudeep, let me get your view in as well from a Piramal Glass perspective. You've heard Prakash mention from his side as to how they manage. How did Piramal Glass manage? The core challenges that automation is yet to solve for packaging and logistics.
I think Prakash and I come from almost the same industry, but obviously he's much wider. And our portfolio also, since it's a healthcare, I have to restrict myself from the healthcare side. But
Hmm.
again, we are B2B. We serve to the pharmaceutical companies. I think many of the things have been said, but one of the things very important is the agility.
Hmm.
I mean, the latest problem that we see is, you have got the stuff in the manufacturing planning, and almost you are manufacturing it, but the problem is, suddenly remdesivir is not there in the market. FDA has said that it's not working, so how do you manage those kind of challenges? Supply chain challenge is a big challenge that we faced.
Hmm.
That's to make sure that the product is available to the right customers at the right point in time. That's the challenge we faced. Second challenge, actually, if you look at over the last 2 months, even I'm talking about not talking about the all 6, 7, 8 months that we face the challenges. Last 2, 3 months, if you ask anyone, there'll be lots of things actually on the global logistics challenge. Right? You'll see
Hmm.
suddenly 26% of the containers are actually China ward, and another probably 30, 40% is US bound. So suddenly, if you're an export market, you'll have a difficulty in getting your containers, and the ships actually in the India, right? So, and what is the impact of that? Suddenly you'll see that price is shooting up, and so you'll see
Hmm.
that, these are basically a lot of challenges because of uncertainty in the market.
Hmm.
Uncertainty is coming from, one, I don't know what's going to happen first. Secondly, lots of kind of, today this decision, tomorrow another decision, day after tomorrow one more decision. Because of
Hmm.
that, governments after governments, administrations after administrations actually did that. And the challenge actually came back to us, apart from the global economic challenge I talked about. And another just small, I know that I'll have to be restricting myself. And the small thing is that what we have done is quite a lot. I'll probably talk about it, which how we digital digitally transformed our manufacturing. It's in the process. I would not say that we've achieved it, but it's in the process. For the last 3 years, we have significantly digitized our manufacturing facility. We
Hmm.
have put about Advanced Analytics Academy. We are developing talent to look into this market, to serve this market in more global way.
All right, so that's indicative of the way you have changed, the way you work has changed. I want to focus now on the way the leadership thinks, and I'll bring this question to Sumit to sort of get a broad perspective. Sumit, Industry 4.0 rests on that pillar of automation and particularly intelligent automation, and we can see it helping streamline business processes, enable faster decisions, and looking at the range of the business problems which can be solved with the marriage of intelligent automation and artificial intelligence. In your opinion, how will the very face of business management change for the health and pharma industry, considering the bandwidth that it leaves leaders free? I guess the question, just to sum up, a long question into a short one: are we entering a sort of an era of de-headquarterization?
A very interesting question. So I think let me take a one step back, right? So see, up until 8 or 9 months back, when we were not in this unprecedented scenario, the thought process was very different, right? There was a lot of resistance and also different priorities in terms of digitizing the entire organization. Since the pandemic has been brought upon us, things have significantly changed from the mindset perspective as well. If I look at our 4,000 plus customers which we have, we saw that massive needs of responding to the new situation in their own way, and we thought that okay, we cannot respond to all of them in the same way. So we categorize them into 3 different categories of being efficient, to survive, and to save the industry. To come to your particular point, I think what we have seen a massive shift in the mindset of looking proactively managing any new situation that may come upon, right? So trying to become more resilient, and in that case, we are seeing a democratization, empowering of digitization to the at a persona level, to the front office, to the SMEs, to the end users, right? So we are seeing that percolating, and the organizations are looking at technology which can help to achieve that. So it's not only about sitting in a headquarters and basically passing the orders. It's about ground up, empowering the end users to basically be part of the journey and fuel that. So yeah, decentralization is a way which we are seeing in not only in pharma but all the other industries as well.
All right, so we've so far covered the sort of a more B2B perspective. Let me look at the B2C providers as well. In terms of direct engagement with people across diverse sets. So I'll come to you, Rajiv, for this, for Medanta's viewpoint. How has the doctor-patient interface and engagement being reworked using technology?
Sure. So, let me give a favorite example of telemedicine. And there are many myths which got busted with this. We were running the telemedicine show for roughly 3 years or so. But from peak COVID era of, say, March to September, we saw 11 times jumps in our OPD telemedicine consult numbers. So this is huge. And these are not simple, video consulting platforms. These are platforms which are integrated with 9 different systems in the back. It is integrated with our doctors, their appointments, their locations, the disease they treat, the specialty they belong to, the treatment and procedure they carry out, their tariff, their medical records of the patient, and definitely the payment gateways. So these systems, we all were under the impression that patient will rarely use telemedicine, but this definitely got busted. And one more example which we have seen, and there are many myths that only younger generation will use telemedicine. People who are chronic will never use telemedicine. Newer patients will not use telemedicine. All that myths were there. States which were not so, their perception is not so great with respect to digital intervention. UP, Bihar, we have seen 40% jump of patients from those 2 states, especially from Medanta. So all of these myths were there. But what I want to say is that with this intervention, what we have seen is that patient doesn't have to worry about. Patient come to a hospital for 4 possible scenarios. One is an OP for a doctor consult, in IP for an admission or medical intervention, in a ER, or for any diagnostic reason, be it radiology or lab. In all of these encounters, when the patient move out, they carry a bulk of papers, or CDs or films. And what we have done is that we said that you walk out free, and whatever you need from the counter or encounter, it's there in your handheld device. So you just log in there, so patient can see each and every encounter, visits, details in this handheld device for any possible interaction. So this is what we have done. I mean, it's nothing great. Everybody was doing it, but what we saw is that more than 20 lakh odd reports got downloaded in last 7-8 months, which is a huge testimonial of people moving towards the contactless delivery mechanism. This is very small example, but this is one example of patient and doctors or healthcare intervention.
That is important because, as you indicated, there has been a change in mindset. If 20,000 reports have been downloaded, and it's while it might look like a small number, it is still it's still a great start.
20 lakh.
20 lakh, sorry, my mistake. So 20 lakh downloads of reports, that itself is indicative of how people have begun to realize how to use technology to make their lives easier. After all, nobody wants to carry around, a bunch of the diagnostic reports and show it to the doctor, but rather have an ease of an easy platform to interact with their doctors. And staying with diagnostics, Pathkind Diagnostics has been doing a lot of efforts here as well. And Sanjeev, let me come to you for this. Your labs offer hundreds of tests which range from the simplest of screenings to advanced tests under whether it's molecular pathology, cytogenetics, histopathology, hematology. So what are the use cases where you have seen automation having a positive effect on your workflow? And more importantly, I want to ask you, how have you seen it balance itself out with the human factor to create a truly effective productivity system for employees as well, who all work in unique ways? So, how do you determine when process workflows affecting personal productivity is ripe for automation? Sanjeev?
Sorry, my bad. So yeah,
Sure.
I think partly it's been addressed by Rajiv. You mentioned about telemedicine and all, but I'll just tell you as to what we are doing. So I mean, we are a network of labs and collection centers spread across about 15 states now. So we have 55 labs at the moment and about 1,000 plus collection centers. So you can imagine the kind of network that we are running. And every center, obviously, we are actually addressing the issues of the patients, of the customers, etc., etc. So typically, you need innovation for 4-5 things. One is to improve the affordability, to improve the accuracy, to improve the scalability, to improve the turnaround time, and for improving the mobility, or what we also call as the accessibility to the people across the length and breadth of the country or whichever geographies you are in. So if you have to divide the work of diagnostics network into 3 stages, the first stage would be pre-analytical stage, where you are picking the sample, you're reaching out to the customer, picking the sample, doing the registration, and ferrying the sample to the lab to be tested. So this is the first stage, which we call as the pre-analytical stage. The second stage is the analytical stage, which is, after the sample is received in the lab, then you are running the sample on the machines or doing your bit under the microscope or, doing the work manually either through ELISA or something else, and then churning out the report. Now, once the report is ready, then the post analytical work starts, where you are actually delivering the report to the customers. So automation has played a very, very important role of late that we have seen. It's far more accentuated than what it used to be pre-COVID days. So if I have to talk about pre-analytical, what we do is that each and every sample that is getting picked from any customer in a remote location through a collection center, it gets registered there and then using the technology. So what we are doing is at the back end, we are using SAP, which is to take care of the financials, to take care of the inventory management, and so on and so forth. And at the front end, which is a customer-facing thing, we have what we call as LIMS, Lab Information Management System. So earlier days, even the best of the brands, they would collect the samples from the collection center and bring it to the labs for registration. Now, at ground zero, at those grassroots, we are registering the sample there and then. We don't have to fill the TRF or the test request form over there. And in fact, so much so that when we're doing the home collections, there only we are linked through the cloud or the server with the customers, and the registration happens there and then. Then you are taking the sample under the temperature control environment, you ferry the samples, and the person who's ferrying the sample, who's a rider or what we call as a ground force, we can using the technology, we can monitor the movement of that person using the GPS technology, so on and so forth. And then also, what is the condition of the sample? So you're using temperature loggers, which can tell you whether the cold chain, we were able to maintain that cold chain or not. So, so few of the examples. So instead of now getting the samples to the lab and then registering it, we are doing the barcoding at the ground zero. There is no mix-up of sample, which is a possibility. Now the samples, we know that these are accurately, basically linked to the person who has given the sample. Samples are then brought into the labs. In the analytic work, obviously, you got machines and there's a bi-directional interface. So you feed the sample in the machine. Every machine has a computer which is linked to the lab information management system. Whether you're doing the thing manually or through automated manner through the machines, I think that gets that gets linked automatically. The report is generated. Now the question which you also asked was, how is it really aiding the work of the people? So, I mean, there are all these facilities, whether, it is on the, you mentioned about cytogenetics, you mentioned about, hematology and all. So we use telepathology to the hilt for actually, giving the reports of histopathology. So from the remote location, the slides are made. Those slides are transferred to us digitally at the central location where the histopathologist is sitting, and we are able to decipher and tell as to what the ailment is and give our diagnosis. If you talk about serology, how the innovations help us. Earlier we used to have the rapid cards. Then we went on to a technique called ELISA, and now we're using far better techniques or technologies known as, one is the mass spectrometry, LC-MS, MS, or for that matter, even CLIA, which is chemiluminescence technology. So as such, the technology is going up, and then we are on top of that, we are using IT so that we are able to get the work more and more efficiently. Cytogenetics, we used to do karyotyping for looking at the basically chromosomes, and now we are using microarrays. On the molecular diagnostic side, the world has moved from just the PCRs to RT-PCRs to Sanger sequences, and now we talk about next-gen sequencing. So there are multiple things which are happening on the on the analytical side. Now coming to the last bit, which is the post-analytical. When you are sending the report, you have to ensure that the report is delivered digitally to the people pronto. I mean, they can't wait for 5 hours, 10 hours, 15 hours. So digitally, they can access the mail either through hooking onto the website, or we are able to send the mails or the WhatsApp. And so there are multiple things which can be done, and not so much so that we are able to give them if they are visiting our labs, we are able to give them the record of their previous visits also, and give a graphical representation of how the values are going. So if you're taking a lipid profile, what happened during the last visit, how the values have changed from then. We have got chatbots. We're using chatbots to basically address the queries of the customers. So multiple possibilities. And
it's quite an extensive list in terms of developments which have happened and how automation has enabled that for you.
So much to talk about, really. And I think given the time constraint, actually technology is overwhelming. I think what we can do, the potential and the possibilities are enormous.
Understood. But what I guess the thought on most people's minds would be, especially on the speed aspect of it, and considering the pandemic times that we live in, the question would also be, how will the speed of the vaccine that reaches them be affected, and how can it be faster? And Prakash, I'd like to bring you in on this. How is automation supporting precision and faster delivery for vials and packaging of the vaccines?
Yeah, so in terms of the precisions, we are in fact certain production manufacturing not in India but outside India, we have shifted it to kind of a robotic technologies. We are using artificial intelligence, and also the machineries are controlled by artificial intelligence, like Industry 4.0, where you can control the machine sitting in a room. So you don't have to be on the production floor directly to control the machines. So because especially, and that's valid for all, but pharma particularly when it comes to vial, precision and accuracy is very, very much required. So it is a kind of a matter of life for anyone, any single patient using it. So precision, we are using its technology to its best to the extent available, and also the artificial intelligence to have it best, and also the latest technology, as I mentioned earlier, the metal free, the latest innovations, the development of the molecule together with using the analysis of data, again using the technology, so that we have
All
the
right,
right
we'll
data
come to the
available for
automation
future.
planning journey story of Nirmay and 1mg. But before that, Sudeep, your take on this, how automation has supported precision and, with regards to faster delivery for vials and packaging of the vaccine. What's the Piramal glass view on this?
Much of you I can just provide at this point in time because of a little bit sensitivity, but certainly we are working on it, and there are only few suppliers, I mean, a few vaccine providers in the world, and we are working with them. And certainly we are in the process of doing it, and lots of automation. Actually, different demand points are there around the world. We are trying to cater to. Basically, planning is more important. Planning means demand planning as well as supply planning, and we are in the process of marrying the two. And I must say that it's
All
work in
right,
progress at this point
Geeta,
in
let me
time.
come to you. It's a very interesting story in terms of what Nirmay Health Analytics has done, and it's in the context of the fact that there's been a sea of change in the way consumers access various healthcare services, as you heard in the discussion. With a growing acceptance of digital and home-based services. Now, besides being a pioneer in breast health screening by creating a low-cost, accurate, automated, and portable cancer screening tool, Nirmay has also developed an automated COVID-19 screening solution, I believe, recently, and that leverages its expertise in thermal imaging and AI. So take us through your automation planning journey and the broad areas where automation supported value chain creation for diagnostics.
Sure, great to be part of this panel. Yeah, as you rightly said, right? So initially, of course, Niramai being non-invasive risk assessment through AI being in the name, the key idea is to use AI to non-invasively detect health risks. So when we started off with breast cancer, which is one of the largest cancer killers in women, we saw that there is absolutely no test for women under 45 years of age and women who have dense breasts. And so we wanted to address this issue. Of course, the current tests are not affordable, accessible to the large-scale screening that's needed, right? And so what we have done is to sort of use thermal imaging, which is a new type of imaging, and coupled it with AI. Of course, thermal imaging was there, but bringing AI into it makes it really usable, accurate, automated, and non-subjective. Because radiology in general, definitely requires very highly expert, skilled radiologists. Having said that, there is a lot of subjectivity because it's a very, very complex process, cognitive process where there's bunch of images and use your bare eyes and then try and figure out if something is wrong, somebody has cancer or not. So in order to address this, AI, be it in thermal imaging in Niramai or even on mammography or any other type of imaging, X-ray, so and so on, AI kind of plays a big role. And so in the same way, we're using AI to provide a non-invasive breast cancer detection test. And as you also alluded to, yes, because our team has a lot of expertise in thermal imaging, when we saw this COVID issues popping up everywhere and there was huge lockdown, people wanted to open up, we said, okay, can we do something with technology? So what we have developed is to have this thermal camera, and attached to it is a software which keeps watching what this thermal camera sees. So you just keep this thermal camera at the entrances of your buildings, and then our software keep watching people walking by, figure out if somebody has likely cancer, likely COVID or high temperature, or whether the person is wearing mask or not, whether he or she has respiratory issues. So all of this is automatically analyzed using computer vision and thermal imaging technologies. And we give a report saying, okay, so many people walked in, these were the temperatures of all. And this is done without any security guard coming and poking infrared thermometer on your head and making errors while doing so. And it's very, very seamless. The people just sort of walk in and, they won't even know, it's like a CCTV, right? Just out there and somebody's watching you. And only on people who, when you find a COVID symptom, only then the actual picture of the person is taken, and you can actually provide this. So this is a new product we developed called Fever Test. We also leveraged the need for providing home services. So we've started home screening of breast health itself, which is first time ever cancer screening being done at home. So technology really, when used in the right way, can make a huge difference to enable high quality healthcare in an affordable and accessible way as well. Because we actually also do large scale screening at rural areas and so on. So what that enables is without a doctor, can you do a provisional triaging kind of a thing with simple health workers taking, generating these reports, training large number of people, so that we can bring the people who actually need, real care at the hospital to the hospital. So that way, you're moving, unnecessary, crowding at the tertiary care. That can be done with sophisticated technologies. I mean, I
So
can go on and
how
on,
has
but
the response been so far? How has the response been so far?
the response has been pretty good. We were very skeptical when we said like it's home screening. Will people be comfortable? We are continuing to increase this number. It's doubling every month, and it's something that we launched only in July. So that's picking up, as well as COVID screening is also like a very large workspaces, co-working spaces or offices are actually putting this in. I mean, some of them want it in 10 gates, and so you have a dashboard where you can see all the activities, So, and this is COVID symptom activity we're talking about. So all this was possible mainly, of course, with AI and all of it becoming more mature as well.
Absolutely, it's great to hear all the developments across the value chain and across within the pharmaceutical and healthcare industry, the variety of applications which are coming to fore, and finally, at the end of the day, it's the customer who is getting the benefit of it in terms of ease of access and ease of management. And keeping that in mind, Tanmay, I'll come to you. The 1mg story is also fascinating. E-pharmacies rode the e-commerce wave, where shared logistics, transport and supply chain infrastructure, it culminated into a tech ecosystem opportunity. But when 1mg started, I guess it had a monolithic infrastructure across all of its three verticals of pharmaceuticals, labs and doctors, which was sort of rebuilt to work on a microservices architecture. Now you have effectively used automation technology to achieve scale. So I want to understand, what lessons did you learn in that transformation process, and what parameters does your team now look at when it comes to using automation in improving your service, which I believe includes 12 projects where you're using AI and ML?
Yeah, so look, we are relatively the newer kids on the block compared to our esteemed colleagues here. And for us, our whole foundation and DNA was based on technology. So in our case, we are not implementing or putting in layers. This is what we were built on. And you're right that the primary service that we started with was e-pharmacy. But I think over time, as we have scaled, and now there are reasonable businesses that are built along verticals of not just medicine delivery at scale, but even home collections and diagnostic services. How we are looking at information at this sort of what we call as the integrated service view is that given that these pieces of services that now have been built, how do we now understand the user needs better, and we can package them into more sort of customizable services rather than as individual piecemeal services. And this integrated healthcare approach had been our sort of vision right from the beginning. Of course, it takes time to set the foundations, which is what we were doing. And I think now the whole digital part, integrated part, has started to play out, right? With almost 3 billion plus data points of, over the last sort of 5-6 years of our existence, with users sort of buying medicines and, doing diagnostic services, doing e-consultation on our platform. We have started to now, for various sort of targeted therapy areas, we have started to bundle these services into more custom packages, right? So, for example, if you're a diabetic or if you're a hypertension patient, you have very specific needs, right? So, and those are the needs that we are now trying to offer via, custom packages that we have built that uses technology extensively to understand your behavior and your disease progression, and all of that by virtue of the extensive amount of data that we have over time collected. And the whole idea is to change the way healthcare is delivered, and these are the new models that we are basically working on to make sure that it starts becoming more personalized and more customized rather than more transactional in nature.
All right, but it also, I guess, brings into focus the fact that we've got so much data now, which brings into question information security and compliance as well. And I'd like to get in Vivek's point of view on this. Vivek, how does information security and compliance aspect work in sync, with automation planning journeys in general that you've seen and specific to your companies? Because as Tanmay mentioned, it's all about that data which comes in and how you use it to personalize services to customers. But considering the sheer volume of data coming in, it's also brought into focus the question on information security and of course compliance, considering it's the healthcare industry. So take us through those aspects of an automation planning journey.
Right. So basically, information security is one of the very critical, important part of IT in any pharma company. And to be precise, our IT security budget has been more than one-third than the overall IT budget. So there are a lot of products and services which we implemented in the last 2-3 years. Starting from the endpoint or the SOC monitoring through a Big Four consulting company, or getting into a ISO certification, ensuring how we stand on the endpoint security, and performing the VAPT, which is the vulnerability assessment and penetration testings. When doing this kind of automation, naturally we have to ensure the data is safe. There are non-GXP data which we also use cloud. To be precise, even our US plant, the entire data center is on cloud. So coming from that aspect, we have to ensure that security is very tight, and we have to give the confidence to our customers. So from that perspective, we engage a lot of consultants, especially the global consulting company, and we periodically do these assessments and show these reports and certifications to various customers to build the confidence. Apart from that, we, as I said, the PT, which is penetration testing, we periodically do this so that to ensure where there are weaknesses. And when talking about automation, when you bringing OT, that is IoT, in the reactor area and the production blocks area, where you need to set up Wi-Fi. And as I said earlier, when you are using these virtual tours, you need to have Wi-Fi across the plant. So when we are implementing this, we ensured even these network, the Wi-Fi access points, the flame-proof and non-flame-proof, everything are completely secure and tightly controlled, and the ports, unnecessary ports, are blocked. And periodically see with a third-party red team and blue team and see if they could able to hack into our environment. So not only from those aspects, we periodically review the entire security control, uh, fewer weekly, fewer monthly, and quarterly basis. And we also engage a lot of third-party consultants in accomplishing this. So this gives a whole perspective. Wherever there are gaps, we evaluate a lot of new products and services, and we
all right, so that's the information security aspect of it. I'm also going to look at availability as a challenge, and I'd like to come to Sanjeev for this. Sanjeev, how can issues around, say, electricity, connectivity, security, of course, and resource availability be addressed when it comes to deploying a successful automation strategy, especially as companies make deeper inroads into rural India? What's your view on this? So I believe your mic is muted. If you could unmute your mic. Go ahead, Sanjeev.
Yeah. So by and large, I think we are very well connected now. But the unfortunate part is that the bandwidth is still not there. So you have to create your own VPNs, or you find out your own way, build redundancies and all, to ensure that the connectivity is available 100% of the times. Because there cannot be any time when you can work offline. The moment you start doing it, you will be deluged with so much of backlog that the patient will become disgruntled and they'll not be able to get the reports on time. So I think we face all these problems typically in the tier 3, tier 4 cities, where what these smaller collection centers or smaller labs. There, oftentimes what we see is that you are out of in connectivity, and then during that precious 2-3 hours, you have to somehow either you use the hotspot or do a bit of jugglery here and there, so that you are able to actually send the reports, or you are able to reach out to the customers and the doctors, the prescribers on time. But by and large, we see that things have evolved, and last 7-8 months what we have seen is things have actually improved, because the service providers, they're also cognizant of the fact that they need to really reinforce the infrastructure, and they are doing their bit. So by and by, I see the things are improving. Yet there's a lot which can be done in this aspect. There are multiple other challenges which I can allude to maybe a little later. In our industry specifically.
All right, from challenges, let's look at enabling of growth. And Rajiv, I'd like to come to you on this. Considering that whole doctor-patient interface and engagement has itself changed, and you gave us a few examples. But what are some of the tech enablers of growth, and when it comes to healthcare, and what are the areas where we can expect innovation from here on, led by technology?
So you are very, very right. In a country like India, where the gap between demand and supply is so huge that by traditional method, if we try to build that gap, it will take decades and decades and decades, and God knows whether that exponential gap we will meet or not. So tech is one of the right, enabler for this. I'll give you one example. We have realized that getting an appointment in Medanta for Medanta doctors is very difficult. So we have a channel which is a website, then we have another channel which is our call center, and then we still realize that there is a difficulty. So in somewhere in September timeframe, we opened our WhatsApp enabled bot, and it's a complete bot which is fully integrated, and it also has a built-in AI mechanism into that. In 3 months, we realized that without doing major promotion around that WhatsApp number, patients started using it extensively, and that's the patient experience part. I'll give you another example. We run probably India's largest CSR activity, which is called TB Free Haryana. In this, what we do is that we have a couple of vans which goes to each and every district, and sometimes in the remote areas, where we screen roughly between 180 to 200 odd patients in per such cycle. So now what happens is that an X-ray is done, so we know that roughly 10% of the folks probably will come in the TB screening in each of these exercises. So now, but a radiologist has to see 200 X-rays, and then what happens is that most of the patients or subjects which are coming for the screening are daily wages labor. They don't want to wait for the whole day, and it is very, very difficult to trace them back if they go, and we don't know from where they came, because these are not like properly GPS enabled houses and other stuff. So what we do is that as soon as the X-ray comes out from the X-ray modality console, there is a software which is there, and it's like almost with 89% or 90% sensitivity tells that subject has a TB or no TB. So at least what I'm doing is that instead of filtering all the 200 odd subjects, we are not filtering roughly. There is an error, so that's fine. Now, but doctor doesn't have to see 200; they have to see only 40. So which makes life very, very easy for doctors, for technicians, and we have been able to do this. So this is one example of AI or tech enablement on how to do better screening. Dr. Geeta, talked about breast screening, which is also one of the major reasons for cancers in India, and many such examples are there. I'll give you another example in which in the OPD we realize that patient wants to hear a doctor. We all know that half of the problem is solved if doctor and patient do good conversation, face to face, healthy, hearty. Now doctors have to write all the prescriptions on a piece of paper, which was consuming most of the time. We build a machine learning, doctor specific and disease specific, kind of an algorithm. Suppose doctor says that okay, the patient has severe stomach ache for last 3 days, so this is enough. Based on this, doctor's previous prescription, previous diagnostics, and next follow-up dates will come automatically. Doctor has a choice. He can drag drop few items, and we have realized that earlier the medication errors, because doctors are also humans. Sometimes they are writing all the medicine, but they are missing one medicine. Sometimes they are writing all the tests, but they are missing 1 or 2 tests. In this case, system is enabling them to write. Look, instead of writing, they are just reviewing it and doing it. And this is not generic. This is doctor specific and disease specific. So this is that, doctors are very happy. Moreover, it's like voice enabled, nothing very rocket science. Everybody knows voice enabled. So it is just application. See, tech is never sexy. It's the application which makes it very sexy. So you have to make it very attractive for, it's a use case which is important. So,
I
all
guess
of
you
these
could write it on a T-shirt. That's a very pertinent point you mentioned, Rajiv. That tech is never sexy. It's about the application of it that makes all the difference. And you mentioned bots, and I guess Vivek also mentioned about RPA. So I guess I'll bring Sumit's point of view on this as well. Sumit, robotic process automation is creating better health outcomes in the healthcare industry by creating a highly secure, scalable, and reliable workforce to access, process and retrieve data to make better decisions for patients. So I want to understand, what is Automation Anywhere's approach to this space? Do you see automation marketplaces where, say, customers from diverse sectors, where they're able to leverage pre-built automation becoming a more popular solution, especially with, say, small and medium companies looking to cut costs in the pharma and healthcare industry?
So thank you for that question. I think, Gautam, and tech is certainly sexier when you apply it in a better way. So completely agree on that particular statement. Now, let me take some examples to your questions from the speakers who have spoken here about, right? So, see, the application of technology, first of all, is depending. It's not about force fitting a tech into a particular space, right? It is more about trying to solve the problem. And if and a problem could be with large scale organizations, or it could be a small scale organization, but trying to solve a bigger problem over there, right? So the technology landscape or your system which you have, or the enterprise application you should have, should be agile enough to respond and cater to any of these challenges which is faced by the organizations, irrespective of their size. Now, let me give you an example. Right now, let me give you an example of large scale deployment which happened. So when we're in the thick of pandemic, say 4 or 5 months back, and as a global example, the National Health Services, they used to collect some 25,000 CRF. I think Sanjeev, you spoke about case record forms, right? So they have to collect 25,000 case record forms, and there are 90 FTEs who were just manually just doing and trying to collect the data, and they had to provide it to the Department of Health and Services to be ahead of the curve. We're all trying to flatten the curve. Now that's where the technology was used. The AI was used with the help of Automation Anywhere, that can basically extract the data. When data is extractable, it can be uploaded into the downstream applications, and there goes the report, right? So that's one applicability of it. Second, what we have seen is that the small enterprises, they had to, because their bottom line have to be reduced, and their top line has shrunk. They were finding innovative ways of increasing their revenue channels. And Rajiv, you spoke about different channels being brought upon, be website, be different chatbots and all. Now, when you have different channels, how do you connect these channels together? Is where RPA comes quite handy, because you've got various different applications which needs to be basically, and in Hindi, as they call it, sutradhar, right? They have to put all of them together and bring that particular the data together, which then can be used for the actual purpose of activity which needs to be done, right? So the idea is, from Automation Anywhere perspective, and also what we have seen is, it's not about force fitting the technology. It is about understanding the problem and apply it to solve the problem, be it a small scale.
All right. I guess it's also imperative to discuss here the culture at work that you yourself need, because while technology offers you all the possibilities for you to transform the engagement experience with customers, it's also about how it transforms the employees as well. And at this stage, I'd like Tanmay's view on at 1mg, I guess the work culture involves lending accountability with empathy, I guess, to get the team ready for challenges with a sense of ownership that the company tries to infuse to its employees. So my question to you is, how can automation be tuned to be more of a coach that enhances employee productivity rather than sort of a referee who enforces rules? What's your view on this?
Yeah, I would like to quote the other value, which is more relevant here, which is done is better than perfect, right? And I think any sort of technology experiments are nothing but like constant iteration. And at least that's a very sort of Silicon Valley ethos, and something that now in India, technology companies are using the same thing. And I'll echo Mr. Sikka's quote that, look, I mean, technology itself isn't going to magically solve the problem application. step of the process is that clearly defining the problem, understanding that what level of technology do you need, because you don't need to use use a cannon where you just need a pistol. So it's very important to make these judgment calls to actually make technology effective, right? And in that sense, the culture which encourages this is do fast iterations, define your problem clearly, and make sure that whatever you design or create is solving a real problem, is not just some academic project that you get very happy about because you use like AI/ML, maybe where you really didn't need even AI/ML, right? You just needed a simple logical if then else kind of checks, right? So it's very important to use the right amount of technological heft for the right kind of problem.
Absolutely.
That's more
Forget the buzzwords and look at the buzz which your actual work creates with your customers. I guess that's the point
right.
there. Taking a version of that question to you, Geeta, as the talent pool widens, how do you ensure automation tools are intuitive and familiar to those who use it? What's your view on this?
Absolutely. I think the tools, technology becomes complex when it tries to give more intuitive interfaces. So that is where the technology needs to be used. For example, at Niramai, our tools or the screening itself can be done by simple health workers. And when we say that, it doesn't mean that screening for breast cancer using thermal imaging is very simple. It is not, right? In fact, we had to innovate in trying to figure out what type of mistakes do these technicians typically make. For example, we used to say, take an image in a particular position, and they used to make mistakes. Left go right, left right go left. So because we're talking about health workers, especially when we do the rule, so we had to come up with technology and algorithms to basically figure out when they make mistakes, and immediately also tell them, hey, by the way, this is how it should have been done, and why don't you send the person a little back, right? Because it's too front, and so on. So use of technology to simplify the interfaces can go a long way, and that is where the complexity should come in, right? Keep it simple for the end user, but you do all the nice stuff. That's where the innovation also can come in, and it's very, very important.
All right, Sumit, any reaction to that? The question of, how do you make tools itself intuitive for those who use it so that they can enable a better engagement with customers? What's your point of view on that?
I think it's, again, I will repeat what I said, first question. It's about democratizing. It's basically taking to the end user, because they are the ones who are gonna use it. So if you can basically remove the different layers to get the direct input and make it very easy for them to use, and not as complex and technical, then certainly I think that's the way to go, right? And I like that quote, right? That done is better than what was that? Done is better than.
I guess Tanmay could help you on that.
Yes, I like
Done
that.
is better.
It's an evolving journey. It's an iterative process, right? You will never have the end solution. You basically use it and you improve on it, and you keep releasing the new versions around it. So yeah.
I guess there's a whole host of quotes coming out from this conversation, which is fantastic from a headline perspective. We're almost out of time. We're almost out of time. So let me get all of your summary statements as to, if for someone watching this, in terms of the one thing somebody should look at from their automation planning journey to never forget. Let's go around the table and figure out, what's that one thing people should remember, companies should remember when they plan that automation journey. Vivek, we'll start with you. A short 30-second answer from everyone on, what's the one thing you should keep in focus when planning your automation journey? What's your view on that?
Look for a proper use case, have a proper scope in place, and achieve the targets and goals on time.
Okay. Sumit, your view?
I think use automation as your friend. It's a force multiplier. It is used to create the capacity. So go for that, and don't look at to solve the most complex problem. Look at the most bigger problem. A complex problem humans are designed to work on.
Okay. Rajiv, your point of view on, when you look at the automation journey, especially for a sector as sensitive as the healthcare journey, to your peers, what would you say as the most important thing they need to look at when they consider an automation planning journey? What would you say to them?
Sure. I mean, I will say that, the consumers or patient in our case have realized that, tech can help them. And there is a myth. So tiger has tasted the blood. So now tiger will not eat the grass. So all service provider have to be very clear that consumers and patients will keep demanding the way of doing business in a simpler and easy fashion. So that's my view. So we all have to be always on the toes. It's the patient who's going to call us now instead of doctor calling the patient.
That's an interesting turn of developments as technology has enabled it to be. Sudeep, your view on this question, when you look at it broadly from a time sensitive perspective, from a security perspective, from a delivery perspective, the one thing which a company needs to focus on when it considers an automation planning journey, the most important, what does it need to be?
In my view, if you look at my sector again, we are catering to the healthcare sector, but actually we're in the core manufacturing, right? So manufacturing sector has got lots of ills and lots of bottlenecks here and there. If you look at across the value chain, obviously there'll be lots of, and we see that continuously. So basically, to my mind, just take a list of use cases, make a universe of use cases that where all you can. Possibly we can prioritize after that. What you can do, very simple things I have seen in the manufacturing world, especially in India and in our company as well. If you just walk through the plant, I'm here only 2.5 months in the company. If you walk through the plant, you'll be seeing there lots of paperwork to be done. Lots of paperwork still. I think we are cutting trees to just cater to these silly processes, right? So starting from there, very silly. But at the same time, I'm saying that these can be automated very, very quickly. We don't need it today. From there to, if you go to the very high-end real planning work for manufacturing, everywhere the opportunities are. Actually, we're in the process of looking at all these over the especially last 8 to 10 months. And during the COVID, and we are seeing that ample opportunities are there to attack these problems, and we can still get quite a few percentage efficiency points actually out of our facility, back-end facility. Yeah.
Okay, I guess to add a quote here, your message would be keep calm and automate. I guess that could sum your point of view on this.
Yeah, absolutely. And wherever you look into the facilities today, you get opportunities. And this is my view in walking through my factories.
All right. Yeah. Sanjeev, your point of view on this. You've got your audio muted, so if you could unmute your audio. Go ahead, Sanjeev. Your statement on the one key important thing a company needs to look for when it plans its automation journey.
See, technology can be quite overwhelming at times, and there are a lot of fancy things which are being done. I think whenever you're confused, I think the only thing you have to keep in mind is keep the customer, the prescribers or the doctors, and the employees in the middle, and weave the technology or the innovation around that. Idea is to really simplify the work as opposed to getting into a complex jargons and things which normally, it becomes a maze, and to come out of that becomes a terrible thing. So idea is to kind of make the thing simple, use the technology which is most suitable to you, and always whenever you're confused, keep the customer on the front and always think from his or her point of view.
All right, let's get in the perspective of the born in digital companies. Tanmay, the 1mg answer on, what's the key element a company needs to look for when it considers its automation planning journey? How is your answer going to be different from whatever you've heard till now?
Actually, it wouldn't be very different. I'll just probably phrase it differently, and I would echo with at least those who are in the consumer or patient-centric worldview, and which is that always. Any technology solution, always make sure that you size the impact first. Don't just automate for the sake of automation. Always size the impact and co-opt the consumer, whoever is the consumer, whether it's the patient or the doctor. And particularly our view is very patient-centric. So our point is simply this, that whatever you're solving for the patient, make sure that you co-opt the patient. And always remember this phrase that, from a patient's mouth, which is nothing about me without me.
All right. That's quite an interesting addendum to whatever has already been discussed. Geeta, your final statement, sort of, summarizing, bringing it all together and boiling it down to a simple message on, what is the most important aspect, in your opinion, when it comes to automation planning for a company. What's your statement on that?
Yeah, so I'll give a different take. It's about adoption and acceptance of technology by clinicians, basically doctors, right? So, and as newer technologies and newer startups develop new AI and other type of clinical solutions, I remember this quote at RSNA last year. It says, uh, "Please don't worry, AI will not replace doctors, but doctors not using AI will get replaced by doctors using AI." That's
I guess that's a different shift to the conversation, but it is one that is relevant. It's about automation being a sort of a force multiplier rather than being a replacement of talent which is available. Well, it's been fantastic speaking with all of you. It's been a wide-ranging discussion. We've covered many aspects of healthcare, and while technology might be overwhelming, the future still looks bright when it comes to the application of these various technologies to service customers from different sets. With that, it's a wrap for this conversation. I'd like to thank all the panelists for joining us on the Mint CXO Dialogues. And of course, a special mention here to Automation Anywhere for partnering with us on this platform. Thank you, everyone. And of course, thank you to everyone watching. Have a good day.
Thank you,
Thank
everyone.
you.
Thank you.
Stay safe.
Thank you, everyone.
Thank you. Thank you.